101 confirmed cases, and 900 suspected sitting behind them. That gap has widened every day this week.
This is Ebola Watch. I'm Daniel with Cassidy, and the DRC Health Minister is now on record about why that gap exists, which changes the whole conversation.
We've got the Lancet on the PHEIC, MSF pointing to a very specific choke point in testing kits, and Uganda making a move that's bigger than last week's border meeting. All of that right after this. This one's from RFI.
As surveillance efforts have been scaled up in the DRC Ebola response, more than 900 suspected cases have been identified so far, including 101 confirmed cases. WHO Director General Tedros Adhanom Ghebreyesus said Sunday in a social media post addressing violence in the country that is making it difficult to identify infections and provide care.
Quick update on the counts we flagged last time. WHO Director General Tedros says there are now 900-plus suspected cases and 101 confirmed as of Sunday. 2 days earlier, it was 750 suspected and 82 confirmed. So the suspected pool is growing faster than the confirmed count, and that is not the direction you want.
And now the DRC Health Minister is saying the gap opened because of insecurity and lab limitations. So that's not a critic making the structural case anymore. That's the minister putting it on the record.
Tedros' own post spells out what's driving it. Ituri province, nearly 5 million people in active conflict, and 1 in 5 internally displaced. You can't run contact tracing cleanly when the people you need to trace are moving because of violence.
Which brings me back to the 18 people who walked out of that burning Bunia facility. MSF is now warning the outbreak may be wider than known because of testing kit shortages and surveillance gaps. That's exactly the condition we were worried about when those 18 disappeared from view. And now, it's the whole picture at scale.
From the Lancet.
On May 16, 2026, the WHO Director General Tedros Adhanom Ghebreyesus took the unprecedented step of declaring a public health emergency of international concern, PHEIC, without first convening an emergency committee for the Ebola outbreak caused by Bundibugyo virus, Ortho-Ebola virus Bundibugyo, in DR Congo and Uganda.
The Lancet is out with a piece on the Bundibugyo PHEIC, and the phrase they chose is inflection point for solidarity and health equity. Not emergency response, not containment milestone. That's a peer-reviewed journal saying the R&D gap on Bundibugyo-specific countermeasures is a structural failure, not a science lag.
And Tedros bypassed the emergency committee entirely to make this call. The Lancet is calling that unprecedented. So you've got the journal backing the urgency while also indicting the chronic underinvestment that made the urgency necessary.
That lines up with the numbers we've been watching. 101 confirmed against 900-plus suspected. When a journal like that frames the PHEIC as a test of equity, it gives institutional weight to the detection gap argument the DRC Health Minister just confirmed on the record.
The minister says, insecurity and lab limitations. The Lancet says, chronic underinvestment and a global failure to prioritize pathogens that hit lower-income countries. Same problem, different amount of political courage.
Here's TheCable.
So far, the outbreak has resulted in 96 confirmed cases and 11 deaths across the DRC and Uganda, with an additional 867 suspected cases and 204 suspected deaths under investigation since the disease resurfaced in the Congo nearly 2 weeks ago.
Roger Kamba, DRC's own health minister, stood up at the Kampala briefing and said insecurity and lab limitations complicated the early response. That's not an MSF field report or an outside critic. That's the minister himself, on the record. And it matters because it locks onto the confirmed versus suspected numbers we've been watching all week.
I want to sit with that for a second because we've got 867 suspected cases against 96 confirmed. And the minister is basically telling us why that gap exists. You couldn't test what you couldn't reach. That's not a rounding error, that's a structural failure with an official confession attached to it.
The Africa CDC Director General flagged the same thing. The delay wasn't bad luck. It was a cascade from Ituri's security conditions into the lab pipeline. So that 867 suspected figure isn't noise around the 96 confirmed. It's the better signal of where this outbreak was when nobody could confirm anything. From Archana Solanki at CNBC TV18.
The Ebola outbreak spreading across eastern Congo and neighboring Uganda may be far wider than currently known, as violence against healthcare facilities, shortages of specialized testing kits, and ongoing conflicts continue to hamper containment efforts, according to Doctors Without Borders, MSF.
MSF's Parthasarathi Rajendran, executive director of their South Asia operation, is now on record saying the epidemiological situation remains very unclear, and he names a very specific reason: limited diagnostics and testing availability. That's not a generic conflict zone complaint. That's a supply chain indictment.
And the DRC health minister already admitted lab limitations complicated the early response. So now you've got the government and MSF saying the same thing from opposite ends of the institutional spectrum. The detection gap has an official confession attached to it.
Which is exactly why 900 plus suspected against 101 confirmed is not a reassuring ratio. It means the confirmed count may be the floor of something we still can't see the ceiling of yet. The Lancet framed the PHEIC as an inflection point for solidarity. MSF is describing what a solidarity failure looks like in a kit shortage in eastern DRC.
I want a straight answer on those testing kits. Are these the same specialized Ebola kits WHO's Nairobi logistics channel was supposed to be moving, or a separate supply line entirely? Because if Kampala is backing a continental hub and the kits still aren't reaching the tester in the field, then the hub is a pledge, not a solution.
From the Press United.
Africa CDC Director General Jean Kaseya proposed creating an incident management support team in Uganda to coordinate surveillance and outbreak response efforts across the continent. Museveni endorsed the initiative and pledged Kampala's support.
On May 22nd, we flagged the Kampala border meeting as a test, communique or commitment. Museveni's direct endorsement of a continental incident management support team, with Uganda hosting, is the commitment tier. That's a structural answer, not a rhetorical one.
I want to sit with that Africa CDC number for a second. 744 suspected between DRC and Uganda combined, 83 confirmed. WHO is reporting 900 plus suspected overall. Those don't fully reconcile, and that matters if you're a traveler trying to figure out what Uganda's actual exposure footprint looks like right now.
The reconciliation issue is real. Africa CDC's 744 and WHO's 900 plus are almost certainly different denominators, different reporting windows, different case definitions at the margin. What I'd flag is Museveni's own line: Ebola only becomes deadly when there is lack of attention. That's a political signal that Uganda is leaning in, but it also glosses over the fact that attention, right now, means surveillance infrastructure that still isn't fully built.
Right. Backing a hub and having a hub are two different things. So what does someone with a layover through Entebbe actually need to know today, versus what's still just a pledge on X?
If Ebola Watch helps you stay on top of outbreak response, try Hantavirus Watch. Daily updates on the 2026 outbreak, the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. We've put links to all of today's sources in the show notes, so if a particular update caught your attention, you can follow it there and read further. That's Ebola Watch for today. This is a Lantern podcast.